Hey everybody, we're here at In Chiropractic and Wellness with Dr. Todd McDougall, and this actually is Lynn. Lynn actually has experienced some major trauma here just most recently, and you kind of want to share your story just a little bit there, Lynn?
Sure. So last year, July 7th of 2020, my husband and I were out on a motorcycle ride, and while we were out, we went through a curve and our wheel went off the road, and basically at that point we slid and hit a driveway, and when we hit that driveway, I flipped off the motorcycle and landed on a landscape rock.
How big a rock was it?
So it was probably about that big.
Oh no.
So, and at that rock, I don't know how many years ago it was, a motorcyclist actually was killed at that same location. So,
Oh,
very lucky
no.
to be alive.
Yeah.
Yes.
So what was the result of that?
So I had, starting from top to bottom, I had a brain bleed, so I've had a concussion. I've still been suffering from that.
Uh-huh.
I broke my collarbone. I broke thoracic, I think it was 3 to 5
Uh-huh.
on there. Broke some ribs, broke my right ulna, and had a major sprain on my left wrist.
This is terrible. Now, you know, the interesting thing is that we've known each other for quite a while,
Right.
but, you know, we were trying to get you into a little bit better place, but
Right.
unfortunately you actually had a low back issue as well. And, you know, we monitored that and then finally got to a point, it was like, you know what, let's just get surgery on that little sucker.
Right.
So that was actually a perched vertebrae at like at L5 on sacrum. So you actually have rods and screws in that area.
Correct.
Now, with your fractures that you had in the upper back, what do you have in there now?
So I have, I don't know, screws.
Rods and screws again, don't you?
Right.
Yeah, so you got rods and screws in the upper portion as well. Now, you also have some higher complex issues because you've got, you know, you've had some curvatures in your low back.
Right.
So this just makes it even more interesting. But I guess if you want to look at it, one of the benefits of the surgery is that you got about that 30-degree curvature that was in the upper back is now about half. So it's kind of like me and my arm, you know, I say 50% deodorant because now, you know, anyway, that's another story for another day, right? So anyway, you've got some interesting symptoms, okay? So not only do you have the headaches, almost migraine-like, right?
Right.
But you also have some really odd sensations in the mid back or the mid thorax area too, on the right side.
Right.
Now, what's your doctors? What are they telling you right now with this?
So where my pain is around the shoulder blade,
Mm-hmm.
around about mid back. And so I thought, one, it was related to the surgery that I had at thoracic.
Right.
That surgeon's like, nope, doesn't have anything to do with what I've done.
Mm-hmm.
Nothing I can do for you. The doctor that was treating my collarbone,
Right.
he's like, nothing there.
Mhm.
My family doctor is saying, you're getting old, you're gonna have aches and pains.
Ugh.
And at that point in time, this all started right immediately after surgery, I could stand for 2 minutes max, and I would have to go sit down because of the pain in the shoulder blade.
In that same spot, right?
Yes.
And so it had gone away for a while, correct?
So since the accident, so it really all of that started immediately following the accident. It's subsided
Mhm.
substantially.
Okay.
Obviously, I can stand for longer than 2 minutes.
Right.
But I get to the point where if I'm cooking, I can't clean my house. I haven't cleaned my house since July.
Right.
Because it's too painful.
Mm-hmm.
Standing for cooking dinner, that aggravates it. And so I might eat dinner in the recliner because I can't sit up.
Yeah.
Because that's causing pain.
So this is really, really affecting you negatively, isn't it?
Yes.
All right. Well, I tell you what, we'll get some X-rays all squared away here, and we'll go ahead and get on with the adjustments. We've got your examination done. We've noted that you have actually more lower extremity weakness. Your upper body's actually in pretty good shape. So we've already got that done. Reflexes all look good. I've got some little odds and end things, you know, as far as cranial nerve stuff. You know, we talked about, you know, the ears, the eyes, and things along those lines. But anyway, let's see what we can do. Alrighty? Alrighty.
That's good.
Okay, so, you know, here's Lynn's x-rays. What we're doing is we're just kind of going through. Obviously, you see, I take a look at the pelvis, making sure that that's square. When you're dealing with scoliosis, I think it's very important to go ahead and assess the pelvis. And unfortunately, you know, all the orthopedic docs and everybody's dealing and treating the scoliosis patterns. they just don't take that in consideration. They really should. Now, in this situation here, you can see that the tailbone's actually dropped quite a bit there on that left side and through here. And you can see a 4.31 millimeter of deficit over here. These are actually pretty close if you go and you look at that. But the thing is do you go ahead and put a lift in there or not? Well, in some instances, there are some sources that say don't do a lift unless it's 7 millimeters or more. I kind of look at it like this. If there's a, and I usually use foot lifts as opposed to heel lifts. Heel lifts actually go ahead and focus on what I think is the sagittal, whereas the heel lift actually, or I'm sorry, the foot lift will actually go ahead and work on the entire coronal aspect. So that changes the motion in this direction here, okay? But most of the time, I wouldn't go ahead and add anything in there unless it's, 4 millimeters or more, okay? So anyway, you can see that there's actually an angulation right in through here at the lumbar. So what we did was we went ahead and we took a thoracolumbar also. So that's what this is in here. And then, of course, we captured what was going on as far as the curvature in there. It's a 20.9 degree curvature rotation. And you can see how, there's a shift in there at that lumbosacral region in there, and how the artifacts that you see right in through here, that there is the rods and screws, or the posts that they went ahead and put in there. We're going to take a look at that from the side also, so you have another vantage, if you will. And of course, you see the spacer that they have in there. No, somebody didn't lose their wedding ring in there. That actually is a spacer that they put in through there to go ahead and offset this. Now, we talked about this here being a perched vertebrae. We actually treated her for quite a while, and we were able to help her a lot, but it just gets sometimes to a point that mechanically person just needs help. So we sent her out for surgical procedures, and she had that done. Now, as we go ahead and look up a little higher in through here, see she's got a halfway decent curve. Her sacral angle right in there is should be between 43 and 47 degrees, so it's on the high side. But you can tell, in what you look at when you're looking at things neurobiomechanically on set x-rays, look how flat that is in through there. So we know that that is going to be very, very tight, very tight. Okay, and so we go ahead and we moved over here to the thoracic film. And you notice the upper lumbar range, that was actually very flat. You look in through here, what this is going to tell me is that she's got basically muscle spasms from that mid-L lumbar into the lower thoracic range. Now, another thing, too, I want you to take a look at is that what's happened is that, they've got screws in here at number 1, number 2, they skipped 3, they got screws in there at 4, 5, and 6. So basically, if you look, this is really humped in here pretty bad. So they've actually kind of fused her into a thoracic kyphosis in through there. So it's just interesting to go ahead and take a look at that. Now, what we're going to do next, I'm going to go ahead and move over here into the thorax, and of course you can see again the range in here. Now, just so you know, I actually didn't blow this out, believe it or not, but when I went ahead and I tweaked it so I can see a little bit more of the image in through here, then the computer screen actually blew that out. So I thought that was very interesting. Now, some of the things too, as you go ahead and you get in there and you look at this clinically, there's number 7 right in there, and then of course there's T1. So these things here actually spike up a little high on each side of C7. So I'm going to have to be really cautious about how much rotation I'm going to try and do at T7, if I do any at all. Alrighty. And then, of course, in through here, there's really not much I can do with this. So the question is, how am I going to approach this? Am I going to try and relax that upper area when I go ahead and maybe, relax the shoulders? And when I relax the shoulders, will that help increase range of motion and flexibility in through the thorax, even though that's an area that's compromised? Now, in through here previous, because we've got the old x-rays, this 18.4 degrees used to be 30 some degrees in here. So when they went ahead and they fused this together with the rods and screws, they actually flattened that out. This here was, I think, around 19 degrees, and right now this is at 23.6. So there's a lot going on here, just to say the least. Alrighty. And of course, we did go a little wide in through there because I wanted to make sure that I caught all of that, just in case that angle was itself maybe 30 degrees, because you could see that there was a shift in her torso when she was standing there prepping for the the x-rays and then upon evaluation processes. So I'm going to go ahead and go on up into the cervical spine. And again, you can see, you know, how those continue on. So I'll go ahead and I'll get this a little bit more centered. And then the rotation, there's a significant amount of rotation right here. Look at this compared to this here and this here, and then down in here. So it's interesting, you know, it'll be interesting to see if C6 is a major factor as far as us making some correction to go ahead and reduce some of her irritation. Alrighty. And then of course you see how she's got a lean, and then wow, there's another angle right in through there. So next photo or next x-ray I want to do is I'm going to actually go ahead and go to the side there and take a look. All right, so you can see that T1 and then the T2, and then you can see how those enter into the posterior aspect of the vertebrae. And you see that this has been a chronic problem as far as her posture position. See the shape difference in through here? So this has been a long-standing issue. Now, as a whole, you know, she's got a little curve in there. Everything else looks pretty decent for the most part. This angle here should be between 0 and 5. This bone here should be touching the line right in through here, which is coming from here. We call that the anterior gravity line. So that should be no more than 5 millimeters either. These two lines should be parallel. Now, with this lower area basically now all being fused, the likelihood of us ever getting her in an upright position is probably nil to none. Alrighty, so that kind of stinks. So now we're going to do the open mouth. This is a view that a lot of my colleagues are skipping, and they really shouldn't be skipping this, doing some type of weird combo thing, all right? But if you go and you take a look at this open mouth done correctly, look at the amount of space over here versus over here. So what that suggests is that her head is laterally translated to the left. And so you think maybe that could cause some vascular issues. You think that might cause some brainstem issues. I mean, you know, you think that might affect her jaw. Maybe she's got some headaches, sinus issues, ringing of the ears. All of those things could be caused from that. Alrighty. So anyway, what we'll do is go through and do the analyticals, the assessment as far as her examination, just to kind of show what kind of potential orthopedic issues that she may have, and then what the neurological findings may be and how they all tie in. Okay, so anyway, we'll just kind of go from there. Got Lynn pretty much all taken care of here. We're going to do just a few more examination things. Some of these things, which are very in-depth, we've already done, so I didn't want to necessarily bore the viewer on this. But what we will do is just a few more evaluations I do pretty much on everybody, just kind of see how things go with her, okay? So anyway, let's go ahead and have you raise your right leg up high as you can backwards, kiddo. All right, good. And then how about the other one? And of course, you know, you feel how nice that is. All right, now we're going to come in through here and take a look at her leg length. So you want to zip over here, and you can just go ahead and get over in this spot right here, and you can see how short her leg is. Can you get right here? You see? All righty. So you see that this is short, about maybe ½ an inch. Now let's watch this and look at this, how short she goes in this position. Now this is causing pain on the right L3 area. There's other areas that are problematic too, that she noticed that the quadriceps lumborum on both sides seem to act up as well. Now remember, she's got a perch vertebrae right in through here. That is a bit of a problem. So obviously that's going to change how we apply the chiropractic technique. She also has this fused in through here, starting at T1, going all the way down to T6. And then, of course, it actually skipped T3 in through here. So there's stuff that I'm not going to be able to do with this either. Now, her pain is right about here, kiddo.
Yeah.
And there's actually a little bit of a dip. Not sure if there's been torn muscle in this. That could be a piece of this equation as well. So I don't know how this is going to go, guys. So, here we go. This is kind of like, live. All right, so you doing all right, kiddo? All right, so we're gonna go ahead and start bumping things around in through here. Now, these are what she's got, and the issues that she has are all complicated by curvatures that she has, as well as now the rods and screws in her back. this is not necessarily something that a brand new chiropractor is going to be able to do, okay, or should not do. This requires a lot of skill sets. The other thing is, I've done this for, I've been doing this for 24 years. Some of the first scoliosis type patients I've dealt with were some of the old post-polio scoliosis, people who've been in like the iron lung and stuff like that. So I'm kind of like in that between stage, I guess, if you will. So a lot of people, over the years, a lot of experiences too. All right, so right now her legs are balanced again, just by bumping that tailbone, okay? Now what we're gonna do, I'm gonna bring this up in here and see what happened, and do you see the difference? Now, Bree, who's holding the camera right now, has never worked in a chiropractic office before, so are you a little bit blown away already?
Yes.
Yeah, it's kind of cool, isn't it?
Very.
All right, so now what we're gonna do is she's not far off in the pelvis, but enough that we're gonna go ahead and open some of this up for her. So I'm going to go ahead and take this and close this one side and open this other side. You notice I'm not going to do the kick maneuver on her, partially because she's got rods and screws in there on the perched vertebrae. All right? Just like this. All right. You doing okay, kiddo? All right, good. Now, how is this feeling in that low back now?
No pain.
Okay, so how about this side?
Still pain.
Okay, and you feel it on the right, correct?
Correct.
Okay, so obviously I've got a little bit more to do there. Now, on the left-hand side, what I'm going to do is I'm going to bring this up, and her psoas is weak on both sides, so I'm going to go ahead and bump her here on the AS portion, and you're going to feel this in your belly, okay? Just like that. You doing all right? Okay, so now let's see what we got. Do you feel that on the right side anymore? Okay, how about this?
Still there.
Is it lightened up, or is it still about the same? Okay. So, take the PI out of this. All right. Okay. Now, still good? Still no pain on the right?
Just very, very lightly.
Okay, so that's actually new. Now, do you have it with this one now?
It's still there, but much better.
Okay, so now we've got, it's kind of interesting, we're giving and taking a little bit in through here. Okay, you feel how much lighter this is in through here?
Yes.
All right, so I think what I'm going to do, she's got a left apex there at L3, 20-some degrees. So what I'm going to do is I'm going to go ahead and relax the psoas in through here on this side and see how that goes. So left AS, feel that in your belly. And then I'm going to take the IN portion a little bit more, just like that. All right. So now her leg length is still good. So did that take the pain away in the right?
Pretty much.
Okay. How about now on this?
Much better.
Yeah. So you're still feeling a little something?
Still very mild.
Okay, so what I think I'm going to do is I'm going to take that, okay? But I'm going to come over here and we'll bump the psoas on the other side. Now we noticed that this here, yeah, I knew it was going to reduce this or relax this a lot. So now I'm going to come over here, set this. I'm going to take a look and see if there's any trigger points in her knees. Right there. Gotcha. Okay, now we're going to go ahead and bump that. Same thing here. This is where the hamstrings tie in, right? So, okay. Now, mark down what I did here. Both knees in there. I did not catch along the fibular aspect. This here is with a block. Okay. So now I'm curious to see how much of that effect was, affecting her low back here. Still good?
That actually is worse.
It's worse now in the low back?
Yep.
Interesting. How about this?
That's about the same.
Okay, still light?
Yep.
Okay. So, I'm going to have to come back in here and take the block. So, go and raise this leg up a little bit. We'll slide this under. Gotcha. Just like that. So, what I'm going to do is I'm going to work the EX a little bit and that block. And bring this over here. Okay. All right. Now, How's that?
Better.
Okay, how about that? Worse or better?
A little worse.
See what I mean? Lynn's never been one to give me a not hard time. And I'm going to come back in here and I'm going to reduce this again. So I'm going to raise this leg up again, okay? There is a lot going on here, guys. Okay. All right, Lynn. How about this now?
That's better.
And how about that?
Better.
So I'm going to go with better. Okay, so now what I'm going to do is I'm going to use coupling motion next to go ahead and take this out. Now, what am I taking out? Well, what happens is that with the curvature going this way, going to the left, okay? What happens is that's typically a body rotation. Not always. That's why x-rays are always a good idea. But when I use the coupling motion, I'm going to take that from here and I'll move it into a more neutral position. So I've taken the psoas, reduced the irritation that was being caused by this dysfunction here, lighten this, now I can get in here a little easier and open things up. But I'm going to leave L5 alone, right? Because that's got a surgical post in it. So, take this, just like so. Now you notice, I didn't put her in a side posture, I didn't crank on her. She actually, this would be a horrible thing to do to somebody that has all these parts and pieces in there, right? So, okay, now we've got a counter rotation about TA to 23 degrees right in there. So I'm going to go in through here. Now, coupling motion will untwist or unwind up until about T7, okay? So what we're going to do here is, again, use the table to help us move things around. So I'm going to come in here, I'm going to start here, and just gradually work my way up. Now I have to stop though. 6 is where surgical site starts. So I can't get crazy on this. Alright, so that's a right. That's a left. Alright. Now. You doing okay, kiddo?
Yeah.
Alright. So what I'm going to do now is I'm going to go ahead and I'm going to leave this alone right in through here. I'm going to go in through here into the neck, okay? Sometimes, guys, I don't know exactly how I'm going to address things either, right? But the nice thing is her head does move, even though it may not be perfect. So what I'm going to do is I'm going to go ahead and try and take the tension out of here. She got shoulder issues, right? So there's a lot of shoulder tension in there. A lot of times if you have somebody that even has like frozen shoulder, you get in there and you reset that occiput, the shoulder goes boop, works again, right? So she actually has a lateral translation in her head also. This could be another reason why she has the headaches, okay? So let's go ahead and have you turn your head to the left. So I'm just going nice and easy, just bring this in, grab her here. Did you hear that, kiddo? And then nose in the center. And then, nose to the right. There's a very little itty bitty PR here. Good. You hear that go?
No.
Good. Nose in the center. I'm okay with that. Now I'm going to check it to see if it's moving. Got just a little catch in there, so you're going to make me make some noise. All right, nose to the right. Well, I was thinking, okay, good. You hear any noise in that one?
No.
Nose in the center. Let's see what I got. Well, you may not have heard anything, but now I've got motion. And I'm okay with that. All right. Okay, so the rods and screws start at T1. I got a nasty right here at number 6. Alrighty? And then she's got a big old zigzag in through there. Left, body left, with a left apex at 4. And 6 is rotated. So 6 is a left. So I think what I'm going to do is I'm going to just feel around here a little bit. Turn your head to the right for me. And let's see what this is going to do. Doesn't feel good that way.
No, that really hurts.
All right. How about if I push here? Does that feel any better?
No, that's fine.
Okay. So what I'm going to do is you kind of go on the side that you can get a little less pain out of it. Now what I'm going to do is I'm going to push over in here to get the derotation on that number 6 bone in there, but then I'm going to drop it down. Did you just feel that release?
Yep.
Didn't feel bad at all, did it?
Nope.
Nose in the center. All right. And feel how much relief that gave you in that.
Yep.
Isn't that something?
That feels a lot better.
So, just feel in through here. You notice I'm not beating every bone up in there either. I got to write it down. Okay. And then 6. Okay. I got her bumped back up here again. I know her head ain't on right. Always love saying that. Okay, so what I'm going to do now is I'm going to have you turn your head to your right. And so I'm going to try and slide the whole spinal rope back on the head. So what'll happen is that I'll push here. For heads like this, I'll push on the right side and then I'll recenter this. And you may feel this in your shoulder here. This is going to feel a little strange. You feel that?
No, it's all right.
All right, nose in the center. A lot of times, people will be like, wow, that is the strangest sensation. I actually had a young man, 17 years old, who was having seizures. And we were able to go ahead and literally get his head back on straight. And seizures were gone. That's kind of a big deal. Okay, so now what I want to try and do is, I haven't messed with these first ribs in through here at all. So a lot of times I'll go right into that. I don't know that I'm going to mess with them. Because the tension, feel how different that is?
Much better.
I don't know that I need to get in there. Especially with T1 being the first, set of screws in through there. Sometimes it's like, okay, what do you do? So I think what we'll do next is we'll go ahead and we'll see how she does with her leg lift in here, okay? So let's go ahead and do that. Right leg up high as you can now. All right, so that's tougher. Where are you feeling that? Where do you feel the restriction at?
That lower back.
Right here?
That same spot.
Right about here?
Right there, yeah.
Okay, let's go ahead and do the other leg. Okay, so I'm going to go in here on the ribs, and I'm going to see what that does right there at the rib head. Okay, try that right leg again. Did that lighten the irritation for you?
A little bit, yeah.
Go ahead and raise the other leg now.
That's way better.
Way better. Okay, so you have little floating ribs in through here that people forget about. You got a muscle called the iliocostalis, so it goes from the ilium into those ribs and it yanks on those things, all right? And those little things just kind of hang out just like this, all righty? So what I'm doing is I'm going into those areas and trying to reset them. So go and try that right leg again.
That's a lot better.
Does it hurt still at all?
No.
So it's cleared? Okay.
It's just still felt heavy.
Yes. Okay. Well, now what I'm considering is going in here on these ribs. Okay. So this is a little risky, guys, because it's one of those things that in this range here is where this is, but there's a lot of tension here. And again, when the hips aren't working right, that changes all these ribs in through here. They're all they're all contiguous. So let me pull this up in here and just relax your hip. I'm going to take it. Okay, you doing all right? All right, come over here, same thing but different. Good. You okay?
I am.
All right, let's do that right leg up again. Good. How about the other one now? How does that feel?
A lot better.
Take a lot of that tension out of there, eh?
Yep.
Okay, now, this is where you had your irritation here, right?
Yeah.
I don't know that I think there's right there,
Yep.
the dip that you were feeling.
Yep.
And you can feel it. Her doctors are kind of denying that this even exists, but there it is. She doesn't have it. You have some here, but this is definitely more pronounced. So is it muscle wasting? What is it? I don't know. At first I was concerned maybe it was a tear in through here. But now that I'm feeling this here, the crazy thing is that I couldn't feel any of this except that dip because everything was so tight. So I'm going to see what we can do with that. Why don't we go ahead and have you hop up, Lynn, and let's just see what it looks like. Okay. Right, I know I left you down there too long.
Yep.
All right, well, go and walk around and see what that feels like, kiddo.
So that I can tell that you've done movement in the back,
Yeah.
in my lower back,
Right.
but it feels a lot looser.
Feels open?
Right.
Yeah.
So everything, I mean, it just feels like you did release the tension, the
Mhm.
muscle tension.
Can you, do you feel, I mean, when you extend back,
I mean,
is that a little
that's-
easier?
oh yeah, that's much better.
Okay.
Yeah. That's
And-
still tight, but
And where are you feeling that tension at?
so.
You still feeling that posterior? It's not in the
Yeah.
joint anymore, is it?
No, it's more where somewhere my spine, where it's flat.
Yes.
That's where I'm feeling
Okay. And unfortunately, where that's flat, I mean, what they've done almost is that they set this up to where she's in a like a permanent hyperkyphosis in this position now, and there's no fixing that. So that causes her head to jut out now too, which is going to put her in here. So when she has the lateral translation of her head, that just makes all this worse. So one other thing I might try and do is take a look at your jaw, right? So let's see what we have here. All right. So, and let's go ahead and open your mouth up. Okay, close it, and then open it again. Okay. So you kind of twist just a little bit in here, ever so slightly. So let's go ahead and bring you over here and take a look. Now, are you dizzy at all? Or are you okay?
I'm okay now.
Okay. Did you get dizzy just a little bit?
Just, yeah, a little bit when I got up.
Told you I had that effect on the girls, remember? Years ago. I know, that's old stuff. All right, so go ahead and let's have you move this way. So just open just a little bit, just a little bit. When 10 taps are the same mathematically, this little device will shut right off. Got a little crystal in it. So see how quick that was? Okay, so let's open the mouth again. Oh.
Yeah, it's okay.
There's no sticky in it anymore, right?
Yep.
So just a little itty bitty bump in there. So, and that's on the left. Well, so what do you think?
I mean, it definitely helped overall.
Yeah.
Feel better.
Good.
The shoulder blade, we'll work on that. I think.
Is it still a little-
I can still feel it.
Now, you
it's
broke
hard-
your collarbone on that side too, right?
Correct.
Do you want to lay on your back, see if I can get anything else out of that?
I'm good with
Well, let's go over there then. Let's try it out. If we can get, the thing is that, just like you're talking about, the shoulder blade and the irritation and all that, but the collarbone actually a lot of times doesn't heal at the same length, I mean, a lot of people will say, oh yeah, it does. Well, does it really? Is it ever right again?
that.
No.
So what we're going to do is we're going to just see what we've got in there. Can you raise your arm up in here? All right. Where do you feel? You feel a stick?
So, yeah.
And where do you
it's-
feel it at?
So top of the shoulder.
So like in here?
No, even over here more.
Up in there?
Closer to the neck.
Okay. So, I mean, there is a block. I mean, it's just stuck. So let's see what this one's going to do.
That one's a lot more pain.
Well, it
In the same
moves.
area, it moves, but
Yeah.
there's a lot more pain in that muscle there.
So the question is there anything else in, ooh, feel that?
Yeah.
It's a big knot in there. Okay. What about here?
Yeah.
Yeah, feel that?
Yes.
Okay. And then
Yes.
feel the pec?
Yes.
All right. And then we've got a little AC joint. So, just like what I did with her her calves, the posterior aspect, I think what I'm going to do is I'm going to try and see if I can bump these trigger points a little bit, see if it helps make her feel a little better. Okay? So, trigger points, spasms. Table's going to get my Tourette's going again. What am I doing? Just dropping my knuckle into the spot. Not trying to get crazy here on it. But, somebody had sent me a message saying, hey, Doc, you got a class on this? It's not really that hard. You're just going in there and getting rid of the little angry spasms in there.
Does it tickle any?
It
It looks like it
It's
tickles.
not- it's
I was
not
gonna say, it looks like it would
No,
tickle.
it's not a tickle.
All right, so let's see what that does now.
Yeah, that no pain.
Isn't that something?
That's a lot better. Yeah.
And all I did, and I didn't get in there, I didn't blast her osseously, So let's go and try the other side now. So, think what I'm going to do, I'm going to work on that pec a little bit in right there. Yep. Oh yeah. She goes. Oh wow. I know. Well, this is nobody's addressed this, have they? Hang in there. No. This is where you're going to cuss at me, aren't you? Yeah, it does. Right in here. Come on, table. Get right in there. Just getting little pieces of my knuckle here. In here. Table. You're right. Bicep tendon too. Okay. Now this one here, see what that's doing. That's good. I'll pull this here a little bit. There you go. Little ulnar component. Now.
Oh, much better. I've needed that for a long time.
Yeah, you have. There is no doubt about that. Plus, then the ulna was sticking in there too, so it was a little different.
That was the bone I broke as well. So.
Yes. Right.
Yep.
So what you got in through here? Do you feel a stick? I mean, it feels better, but I'm going for it.
So I can feel a stick probably out here.
All right, so that's just more trigger point stuff then. Come on, table. Okay. There you go. How's that?
That was good. I could feel it that time. Now I can feel it right there.
Okay, so now you're feeling like here?
No, more right,
All
right there.
So that means their humeral head isn't moving right exactly where it's supposed to be. So I'm gonna get, come on, table. There goes clunk.
Yeah.
That clear it the rest of the way?
Yep. Yep.
Woo! Now, Lynn, do you want me to help you up here?
Yeah.
Is this a good spot?
Yep.
Okay. With a lot of times when people have the low back issues like that, post-surgical, a lot of times I let them get up all by themselves because that can set them into spasms pretty bad. How's that feel, kiddo?
That's what I've needed that for a long time. Much better. My shoulders feel better. My back in general.
Just in general?
Yeah.
Glad we got you back in.
Yeah.
Good.
Yeah.
Anything you want to, say? Just there's so many people that are watching this, right?
So, the one thing that I always talk about, Dr. Todd, is that I've went to chiropractors before in my life, and it seems like they do the same thing every single time, and you don't. Today you've done things that you've never done before, and so
try to keep the relationship fresh.
Right, exactly. But you're trying to figure out what the problem is and address that instead of just doing the same thing over and over and over.
Yeah.
So
It's, the big thing is like, I like to tell a lot of the young doctors, every patient should be your personal record or your personal best. So, we've got a long ways to go with you, but today's a good day one.
Right.
Definitely a good day
Yes,
one.
I would
So,
agree.
well, listen, I really appreciate, I know everyone else appreciates you letting us film this. This is pretty intense, granted, but people just need to see that there is hope,
Right.
and I'm glad you're back. I'm glad you let me take care of this.
Yep.
So, anyway, well, this is Dr. Todd McDougall of In Chiropractic and Wellness. Please don't hesitate to give us a call if you indeed need some help. There's a lot of very talented chiropractors that are out there. You're just going to have to dig them up. Otherwise, we're more than happy to help whenever we can. So until the next time, we'll see you online or see you around. I can't even talk. I don't even know what I'm going to do. See ya. Bye. All right, so we're here with Shay. Shay actually is an intern from Grace College, and so we're real excited to have her here in Chiropractic and Wellness. She got to see me, Dr. Todd McDougall, do my thing all week long, and so what we thought we'd do is just go ahead and give a little sample of what she saw while she was here and what her interpretation was. She actually is at Grace to go ahead and go through the bachelor's program in exercise phys. So maybe she'll be a chiropractor, maybe she won't, but nonetheless, we're going to have a new friend, with the profession here in chiropractic and of course our office. So Shay, how did things go this weekend as far as your interpretation and patient interaction and the like?
I thought it was really cool. The experience here in the office was super awesome. Definitely different from any other chiropractic office that I've been in. The practice was
Busy?
very busy, yes, very busy, but more catered to the individual patient, which I thought was refreshing to see, considering every other practice of chiropractic I've seen has been very, like, it's all the same. You
Right,
go through the
right.
same routine every time.
Right. So, what kind of patients did you get to witness as far as severity of condition, variation in condition, things along those lines?
Most of them came, well, not most of them, but a good majority of them came in with some sort of like chronic issue that they've been experiencing for a long period of time. And some of them to a point where like surgery was needed. They'd already had it. Maybe they had, maybe they hadn't. But if they had, they still had like,
Problems, right?
Problems after.
Yeah.
Doctors told them, well, I don't know what to do anymore. So
What probably surprised you the most?
I think the one that surprised me the most was the one today with the guy from the train wreck. That
Oh,
was
yeah.
insane.
Yeah. Well, you want to share with the group, what he had shared with you?
So he'd been in a train wreck and was
Like a real train wreck.
yeah, like a real train wreck. And he came in. The first time when he came in to see Dr. Todd, I guess he looked like a train wreck too.
Oh yeah, well he had just kind of catch everybody up. He actually had what they call entalgia, which basically is an inflammation of the disc and or could be caused from the facet, which is a joint in the spine that caused him to kind of lean sideways. And he was leaning so badly to the left, you could actually almost try and have to remove his shoulder from his ear. I mean, it was that bad. And so what we found during the time in which we actually took x-rays is that he actually had a lateral translation, a severe lateral translation in his head that actually was causing there to be an additional tension, if you will, in the dura of the spinal cord. And so the final thing that we had done in the office, and I actually had Dr. Ray from Bowling Green, Kentucky, that was here too. So we got to actually witness this whole thing. But the very last thing I had done was I tapped his jaw back into place after setting his occiput, and slowly his body, the entalgia just went away, and he stood straight up. And it's so funny because Dr. Ray's eyes got as big as saucers. So, but you didn't get to see that, but you did get to hear his story and his perspective. And what else did he tell you?
So he told me that when he came in, he was actually like using a cane. He
Yes.
was struggling to walk to a point that he had to use a cane just to get around.
Right.
And by the time he walked out, he said it was flung up over his shoulder.
That is cool, isn't it?
That was super cool. Like within an hour and a half, x-rays, everything like that, he was walking out the door better than he came in.
Yeah, straight up and down.
Right.
Yeah, no cane. And and it's so crazy because a lot of people say, "Oh, that can't happen. That can't happen." Other things that you saw in here, other stories you heard. I mean, like the one lady with the shoulder. She actually had the surgery in her neck. She had the plate in her neck.
Yeah, that was today.
And and so her shoulder movement. She shared that story with you a little bit too, right?
She had almost 100% mobility today.
Yeah.
Like it was insane to see. And it's time after time of that, just with all different patients. You had one the first day I came in,
Mm-hmm.
and then I believe he came back in Thursday.
Right.
So, and he was the same way. Went through surgery. They went in, told him, "Oh, well, we don't know what's going on here." So.
Oh well, and the guy from Findlay, Ohio.
Yes.
Is that the person you're talking about? Yeah, that was crazy. Yeah, to go ahead and they thought that was a long thoracic nerve issue, and so they went ahead and they actually cut him open. This is after 2 years of his arm not moving up over, next to his head. And of course, after the first adjustment, he was able to go ahead and put his arm there. And what did you notice about his expression as he's telling you that story?
He, like, when he's talking about the actual medical experience, he didn't look real happy. But once he started talking about towards the end of the story how he came in to see you for chiropractic care, he just looked amazed, like it seemed almost dumbfounded that it would work. But obviously he's seen it. It did work.
It did. He
changed
experienced
his
it.
life completely.
Yeah, and he's the same age as you. He's 20 years old.
Is he really?
Yeah, he's 20. So, to see somebody who, is having, either seizures or, a shoulder problem or something along those lines, guys, gals, whatever. I mean, there was the one lady that had the bladder issues too.
Yes.
And you want to share that story?
Yeah.
Do you remember?
Not 100%, but
Yeah.
I know that she said she was having some issues with her bladder, just being able to control it.
Mm-hmm.
And then came to see you, and she's really had no issue. She's seen you for 5 years, I believe she said.
Oh no, she hasn't. She's only been here about 5 weeks.
Really?
Yeah. Yeah,
Oh, wow.
5 weeks. And so right after the very first adjustment, her bladder issues, I mean, she got to a point that she couldn't walk out to the mailbox without having a bladder leak.
Right.
And so after the first adjustment, that all shut down.
Wow.
Yeah. So I mean, it's kind of funny because, I mean, you've been here just this week. This is your final day here. Is there anything that you would like to go ahead and say to those skeptics out here? Because, I mean, truly, you really didn't have an expectation, I don't think, did you, when you came in? So somebody that would be, a total skeptic, what would you say to them in regards to what it is that you saw in here? And granted, listen, this really isn't it's like we talk about. I don't want this to be a sales pitch. I want this to be informative. And I think that's kind of where you're coming from too, right?
Oh, for sure.
What would you tell the skeptics?
I tell them to just check it out first. Like, you can't really just be skeptical and not actually look into it. You've got to at least experience it and really hear the stories and the testimonies of it.
Mm-hmm.
And, like, look at the lives that it's changed.
Yeah.
Because there is science behind it. It's
Sure.
just, you've got to look into it.
Mm-hmm.
And to be skeptical, I mean, I guess that would kind of make sense in our society, but...
Yeah. But I think what we see is we see so many people that are now trying to do all these other kinds of things. Now, in the practice, how much exercise am I doing in the practice? How much physical therapy? How much rehab? How much? And at the end of the day, what would you say percentage-wise our success rate was with every patient? I mean, we saw almost 170, almost 180 patients this week. Of those patients that I saw, that you witnessed, how many failures did we have?
Not a single one.
Isn't that crazy?
Every single person walked out better than they walked in.
That's pretty neat.
Yep.
That's pretty neat. So, ending thoughts? Because, I mean, truly, you're considering becoming a chiropractor, right? Sure. Not that you will. I mean, it was probably tough watching me because I have walked around with an injury all week.
Right.
But, still coming out with 100% success rate as far as, making changes in people. What's your general thoughts as we go ahead and close this video here today?
I thought it was a super awesome experience, just being able to see it in action and everything like that.
Mm-hmm.
But it definitely gave me a lot to think about, for sure. Like,
right.
It's a very demanding career. It's a very fast-paced job, but
mm-hmm.
definitely something that should be appreciated by whether you're a patient, other chiropractors. It's something to look into.
That's awesome. Well, listen, Shay, I really thank you for doing this interview. I mean, I just wanted to kind of get a vibe, as far as how you thought things were. And I know you actually have to do a report for Grace.
Yes.
So that ought to be interesting, right?
It'll be good.
But I've really enjoyed you being here. And, anybody who's interested in doing a shadow opportunity, I highly welcome them. It's one of those things that the more people I can share the success of chiropractic, the more that we can help other people, and the more, hopefully, more doctors I can influence in a positive way. It's just like doing the X-rays and the interpretation of those films. Interesting, right?
Very interesting.
So, and how about the correlation of those?
That was insane, because you were able to pick out like what patients were experiencing symptom-wise before they even told you.
Yeah.
Just by looking at the X-rays.
That's so cool. So X-rays actually have a benefit, don't they?
Oh, for sure.
Yeah, I guess it's all about if you know how to read them.
Right.
Little things like that, right? All right, Shay. Well, listen, you have a good one. We'll talk soon, okay?
Yep.
Thank you.